Hi, good morning.
Hello, good morning.
How are you?
Doing good. How about yourself?
I'm doing good, thank you. My name is Niza-Valentin. I'm a nurse practitioner student, and I will be the one assessing for you today.
Okay.
So for today, we're gonna do an abdominal assessment.
Okay.
So before that, I have a questions for you.
Sure.
Do you have any problem with your bowel movement?
No, none whatsoever.
Good. Do you have any history of gastrointestinal issues like GERD, appendicitis, cholecystitis, and
No.
ulcer?
None.
Okay, good. So I'm gonna wash my hands first before we start, okay?
Okay.
So I already washed my hand. So for this assessment, you're gonna need to lay down. Is it okay with you?
Sure.
Okay, and you're gonna lift your shirt.
Okay.
Okay, make yourself comfortable. Okay, so I'm gonna inspect first for the skin color. Okay, your sclera is white. Your skin color is not yellow. There's no bluish discoloration. Okay. Okay, can you lift your arm? I'm just gonna do the tenting.
Okay.
Okay, there's no tenting, so meaning you're hydrated. Now I'm gonna inspect if there's any lesion, scarring. There's no piercing, so that's good. Now I'm gonna check for the shape. So it's brown, that's good. Next, we're gonna do the auscultation. So I'm gonna listen for the 4 quadrants.
Okay.
So I'm gonna use the diaphragm of the stethoscope because of the high-pitched sounds. Okay. Okay, the vowel sounds are normal active, which is normal. And now we're gonna listen for the bruits. We're gonna use the bell of the stethoscope because of the low pitch sounds. Okay, we're gonna do for the aorta first. And for the renal, we're gonna do the iliac, which is knee beside the umbilicus. Okay, I'm gonna check for the femoral too. Okay, so I didn't hear any bruit, so which is normal. That's good. Now we're gonna do the percussion. Okay, so it's tympanic on all 4 quadrants. And now we're gonna percuss for the liver, for the spleen. Okay, so it's down because it's a solid. Now we're gonna percuss for the liver span. Okay, so it's 8 centimeter at the mid-clavicular line. Okay, so that is normal. Sorry. It's because the normal is 6 to 12 centimeter.
Okay.
Okay, so now we're gonna do the palpation. So we're gonna start first with light palpation. Let me know if there's any pain or tenderness, okay?
Okay. No, everything's okay.
Okay, so now we're gonna do the deep palpation. Is there any tenderness?
No, everything's
Okay.
good.
So now we're gonna palpate for the spleen. Okay, so I didn't able to palpate the spleen, so that is a good sign. Because if I will be able to palpate it, then that's you have like an enlargement or what. Okay, so now we're gonna palpate for the liver. Good. Be able to palpate it. Can you take a deep breath? Okay. So. Okay, so it's 1 cm below right costal margin. Okay. Now I'm gonna palpate for the kidney. Okay. Okay, so they're not able to palpate the kidney.
Okay.
So that is good. So I'm gonna palpate for the abdominal aorta to check if there's any pulsation.
Okay.
Okay, so there's nothing.
Okay.
So now I'm gonna palpate for the femoral and inguinal for the lymph node to check if there's any swollen. Okay. Palpate for the femoral first. Then the inguinal. Any tenderness, pain?
No, none.
Okay, so I didn't palpate any swollen or... Okay, so now we're gonna do the special test. Sorry. So now we're gonna do the Murphy sign.
Okay.
So I want you to take a deep breath. Okay. Is there any pain? Okay, so it's negative. Because when it's positive and you feel pain on that area, when I palpate it, put pressure, meaning that you have a cholecystitis or any problem in the gallbladder, something going on in the gallbladder. Okay? So which is good that it's negative. So now we're gonna do the test for the appendix. We're gonna locate the McBurney's point, which is in the right lower quadrant. So we're gonna do the rebound tenderness pain test. So if I'm gonna lift my arm and you feel pain, okay, let me know.
No.
Okay, so that's negative. Now we're gonna do the Robson sign. So the Robson sign is I'm gonna put pressure in the left lower quadrant and you will pain in the right lower quadrant. Okay? Do you feel pain?
No.
So, okay, so that is good. So next we're gonna do the psoas sign. So the psoas sign is we're gonna lift your right lower leg at the 90 degrees and I'm gonna put pressure like towards your body, and if you will pain the right lower quadrant pain. You feel pain?
No.
Okay, that's good. And then the obturator sign is this leg, I'm gonna rotate it internally. And tell me if you're, no, but still 90 degrees and still, you feel pain?
No, none.
Okay. So that's good. So it's negative for the appendicitis. So now we're gonna do the CVA test, like CVA tenderness to check for your kidney. Okay, can you sit down again?
Sure.
Okay. So I'm gonna percuss for the CVA tenderness. Let me know if there's any pain, okay?
Okay.
Do you feel pain?
No.
Okay, so that's conclude my assessment. So everything is normal. Do you have questions for me?
No, none whatsoever. Thank you for your
Okay,
time.
thank you so much. Have a great day.
You also. Thank you.